Asthma is a chronic respiratory condition characterized by airway inflammation that leads to wheezing, shortness of breath, chest tightness, and coughing, particularly at night or early in the morning. Anxiety, on the other hand, is a mental health disorder associated with excessive nervousness, worry, and fear that can manifest in both physical and psychological symptoms. While asthma attacks can be triggered by various factors such as allergens, exercise, or stress, anxiety often flares up during periods of high stress or in response to specific fears or phobias. The primary treatments for asthma involve the use of inhalers to reduce inflammation in open airways, while anxiety is managed through therapy, medications, or a combination of both. Asthma risk factors include a family history of the disease, allergies, and environmental factors, whereas anxiety can be influenced by genetics, life events, and personality traits. Here's a deeper dive into the detailed aspects of both asthma and anxiety. Primary presentation: respiratory distress versus psychological distress. Respiratory distress, a hallmark of asthma, typically presents with wheezing, coughing, and shortness of breath due to bronchoconstriction. Emergency treatment often involves bronchodilators and corticosteroids to alleviate these symptoms. In contrast, anxiety might mimic asthma with symptoms like rapid breathing or chest tightness, yet it primarily stems from psychological distress. Treatment typically includes psychotherapy and, if needed, anxiolytics. Distinguishing between the two can be challenging, as anxiety can exacerbate asthma and vice versa. Proper evaluation often requires spirometry exams to assess lung function for asthma or psychological assessment tools for anxiety, ensuring the appropriate management for either condition. Trigger factors: allergens, exercise versus stressors, traumatic events. Differential diagnosis between asthma and anxiety can be particularly challenging due to the overlap in symptomatology, such as shortness of breath and chest tightness. However, trigger factors provide a discerning lens. Asthma attacks are predominantly provoked by physical stimuli like pollen, pet dander, or exercise, essentially elements that irritate the airways. Contrarily, anxiety, especially panic attacks, often stems from psychological stressors, including acute stress or exposure to traumatic events. The body's response to these emotional triggers can mimic asthma, but originates from a fight-or-flight reaction, leading to hyperventilation and a cascade of anxiety-induced physiological changes, which are distinct in origin from the inflammatory airway response seen in asthma. Symptom onset: acute episodes versus gradual, rapid. Asthma often presents with acute episodes of wheezing, coughing, and shortness of breath triggered by factors like allergens or exercise. These symptoms can escalate quickly, making it challenging to breathe and requiring immediate treatment for relief. Conversely, anxiety generally exhibits a more gradual onset of symptoms such as restlessness, increased heart rate, and a sense of dread, although panic attacks can mimic the rapid onset seen in asthma. Notably, anxiety can exacerbate asthma symptoms and vice versa, creating a complex clinical picture. Discerning between the two conditions relies on a careful patient history and may require diagnostics such as spirometry for asthma or psychological evaluation for anxiety. Treatment approach: inhalers, controller medications versus psychotherapy, anti-anxiety medications. Asthma, a chronic respiratory condition, is characterized by airway inflammation leading to wheezing, shortness of breath, and coughing. Treatment primarily involves inhalers containing bronchodilators and corticosteroids to manage symptoms and control inflammation. On the other hand, anxiety, a mental health disorder, manifests as excessive worry, unease, and physical symptoms like palpitations. Psychotherapy, such as cognitive behavioral therapy, CBT, coupled with anti-anxiety medications like selective serotonin reuptake inhibitors, SSRIs, forms the backbone of its management. Differentiating between the two is essential, as mistaking anxiety-induced breathlessness for asthma can lead to inappropriate use of inhalers, which do nothing to alleviate mental distress. Conversely, overlooking asthma can result in dangerous respiratory complications. Thus, a careful assessment is crucial to ensure that each condition receives targeted, effective treatment. Associated findings: wheezing, airway inflammation versus palpitations, muscle tension. The intersection of asthma and anxiety is a fascinating realm of differential diagnosis because both can manifest with respiratory distress. Asthma is primarily characterized by wheezing and airway inflammation, often triggered by allergens or exercise, leading to bronchoconstriction and difficulty breathing. On the flip side, anxiety can provoke palpitations and muscle tension, potentially simulating asthma symptoms due to hyperventilation in panic attacks. However, anxiety does not directly cause the airway inflammation central to asthma. Discerning between the two involves careful patient history, clinical examination, and possibly pulmonary function tests to identify airway obstruction in asthma, as opposed to primarily normal physiological function with secondary symptomatology in anxiety.